Good evening, ladies and gentlemen, and welcome to another episode of Ask the Expert, hosted by the Lupus Foundation of Jamaica. Today is a special day. It's World Kidney Day, March 9th, 2023. Tonight, I will be your moderator. My name is Raquel Lowe-Jones. I'm a nephrologist, and I'm pleased to have Dr. Chrysostom as our expert tonight to discuss the kidney and lupus. We want everybody to be engaged tonight. We want everyone to not be afraid to ask any questions. Feel free. No question is a stupid question, and we're all here to learn, support one another, and gain some new insight into the kidney. I'd like to introduce Dr. Chrysostom. He is a UE grad and also completed his DM in internal medicine and continued to do his nephrology fellowship at the University of the West Indies. We're very happy to have him here tonight to field your questions, and we'll just get right into it. Dr. Chrysostom, could you unmute and have your camera on? Great. Thank you so much for being here tonight.
Okay, thank you, Dr. Lowe-Jones, and good night or good evening, everyone. And a special thanks to the Lupus Foundation for inviting me to speak on this very critical topic. And a happy World Kidney Day to everyone as well. Today is World Kidney Day, in case you didn't know. So yes, what I would be addressing is systemic lupus and its impact on the kidney. So my area of interest is kidney disease. And as we know, lupus is a systemic disorder, which means it affects all organs, or a lot. It has the potential to affect every organ in the body, basically. And as it pertains to the kidney, there are certain markers or certain symptoms we look out for. There are certain...
So before you go on, doctor, could you just tell everyone, because some persons may not even know where the kidneys are in the body, and so let's break it down for them, for our audience.
All right, sure, no problem. So the kidney is the organ in the body responsible for filtering waste products, and it is located in your lower back. So if you were to put your hands akimbo, where your thumb sits, it's in the back. You have one on each side, a left kidney and a right kidney, and it weighs about 130 to 150 grams in most people, right? So apart from just filtering waste substances, let me just put up a slide to just illustrate some of the functions of the kidney.
And there are quite a few functions, aren't there?
Yes, quite a number of functions.
Most persons think that the kidneys are just filters, but fill us in as to what other functions the kidney are responsible for.
Okay, so as we mentioned before, the key functions of the kidney would be separated into filtration, salt, water, and acid-base balance, and hormone secretion. So as it pertains to filtration, it's the usual clearance of waste substances from the body, as well as it reabsorbs substances that we may need. And the waste substances, they come out of the body in the form of urine. It also is responsible for the salt balance. So that would be your sodium, your potassium, your chloride, your bicarbonate ions, and it controls as well the acidity of the blood. Added to that is the hormonal function of the kidney. So in the kidney, there are cells that secrete a particular hormone called erythropoietin, and that hormone stimulates the production of red blood cells. It also has some hormones that are secreted which help to regulate your blood pressure, and there are hormones responsible for regulating how much calcium you retain in your body and how much phosphate you retain or excrete. So the kidney is responsible for a host of functions, and the filtration, the salt, water, and acid-base balance, and hormone secretion are the scope of the functions of the kidney.
Wow, that is quite a bit of information and very important functions the kidney have. Can we live with just one, Doc?
Absolutely. So we have two kidneys, but we are more than capable of living with just one kidney. Each kidney has millions of kidney cells, which they are called nephrons. And even in the instance where you lose 50% of your full nephron capacity, you can still function normally, meaning you could still filter waste substances, you could still manage your salt and water balance and produce hormones all the same. The kidney only begins to malfunction, so to speak, when at least 80% of the nephrons or the kidney cells have been damaged.
And when you say damage, what could be possible, some of the possible things that could damage it?
Okay, so in general, things that could damage the kidney in our population, high blood pressure is the number one cause of kidney damage. We also have diabetes or high blood sugar that could also damage the kidneys, and these occur over time. In this forum as well, systemic lupus
Absolutely.
can definitely
Big problem, big problem.
damage the kidneys, and there are others we have as well. HIV, sickle cell disease. We also have some genetic disorders that damage the kidney over time as well.
Okay, great, great. So let's bring it a little bit home. In terms of lupus, are there any signs that the kidneys may exhibit in a patient who is affected by lupus?
Okay, so let me just go to another slide that I had here to help illustrate. So just a little background information. When lupus begins to affect the kidneys, what happens is you have a lot of circulating. Lupus is a condition, as you know, that you produce a lot of autoantibodies, and these antibodies are directed against your own body. So a lot of potential self-destructing antibodies, right? One that we are all familiar with is ANA. So the ANA antibodies can attack different body systems. Now, in the kidney, sometimes these complexes can form in the blood, and the blood circulates and it ends up in the kidney. That's one way that these antibodies can end up in the kidney and cause a self-mediated attack or an attack on the kidneys. Another way an attack can be formed is sometimes there are certain receptors, or we call them antigens, on the kidney surface itself. And when these antibodies circulate in the blood and they land on the kidney, they attach themselves to these antigens, like a lock and key mechanism, if you could picture it in your mind's eye. And that also leads to an attack on the kidney. Now, when you attack the kidney, think of the kidney as a massive strainer, right? So there are pores, there are small pores in the strainer that allow fluid to pass through, and it allows certain things to be caught in the strainer. right? So when you have damage to the strainer, it causes these little pores to get bigger, and it causes the strainer, the ability of the strainer to filter out everything it's supposed to retain, it becomes a little impaired. So what you have, sometimes larger molecules that wouldn't normally pass through the filter or through the strainer, they end up going through the strainer in your kidney cells and forming part of your urine. So what happens is protein is one molecule that is very large, that is not supposed to pass through your strainer. If you have kidney damage, sometimes the protein may be able to pass through because of the holes that are made in your strainer. Additionally, your red blood cells are not supposed to pass through the strainer. And sometimes you could have protein in your urine, you could have red blood cells or blood in your urine, and you could have a mixture of things that develop as a result of the kidneys being inflamed, all of that inflammation stuff passing through the kidneys, and they call them casts. So this slide here shows the feature that you may develop, as well as the percentage of patients with lupus affecting the kidneys, how they can present. So almost everyone that has their kidneys affected presents with proteinuria or protein in the urine. So when you do your urine tests, the first sign that there is kidney damage is protein in the urine, right?
Oh, is that protein deadly, Doc?
Well, that protein,
how will that affect them?
The protein in the urine is the one we measure is albumin, right? So once you have albumin in your urine, that is usually not too good, because albumin is responsible for keeping the pressure of the fluid in your blood vessels. So when you have blood circulating through your blood vessels, the albumin keeps your fluid, the fluid part of the blood, inside of the blood vessels. So when you pass out a lot of albumin, what happens is it weakens the ability of your body to keep all of the protein inside of all of the fluid, inside of the blood vessels. So you have fluid leaking out of the blood vessels, and sometimes it goes into your skin or just under your skin, which is why one of the first features would be swelling. It could be leg swelling. It could be swelling of your face. When you wake up in the morning, you find your eyes look puffy or your face looks puffy. And then as the day progresses, you find that the swelling goes down and it goes down to your feet. All of that is because the protein in the blood is low because you have been peeing it out, basically. So
Okay.
that could be very that could pose a real problem if it is not addressed quickly.
Definitely, definitely. Protein in the urine, that is definitely something that persons should look out for. But how can they identify at home protein in the urine if they haven't been to a doctor's office? Anything that they can look at the urine?
Well, for starters, a good idea that you may be passing protein in your urine is if you go to the bathroom to pass urine and you find that the urine looks cloudy, or if you find that it is frothy, so it looks like the top of a bear. Well, after you pour out a bear, it looks like the froth from a bear.
Oh, yes, yes.
Those would be early features to suggest that maybe I may have some protein in my urine.
Right, right. And so with that, they should really go to their doctor and get that checked.
Absolutely.
Okay, great, great, great. So we do have some questions in the chat. In terms of one of the questions a listener is asking, should all lupus pregnant females be started on aspirin in their first trimester? So we know that lupus patients are prone to the thromboembolism, or what we call clots.
Yes.
And so what is the advice on aspirin?
Well,
First
I would
trimester.
say that is quite an advanced question. What I would do is just backtrack a bit and
Yes,
speak on just lupus as it pertains to lupus nephritis or kidney disease and pregnancy. So usually patients with lupus are at a higher risk of getting complications when they get pregnant, right? So
yes,
it is documented that a large percentage of patients actually get lupus flares during pregnancy. Matter of fact, it is stipulated that in order for you as a patient with lupus to consider pregnancy, you should be seeing your rheumatologist regularly, and your disease activity, meaning if you're having symptoms or if you are not having symptoms, I should say, if you're not having any symptoms and your level of inflammation is controlled, which we can check using the blood results, it has to be sustained and controlled for at least 6 months before you even consider getting pregnant, because at least 30% of patients with a low disease activity, meaning you don't have any symptoms, you're doing fine, but you know that you have the underlying condition of lupus. At least 30% of these patients will go on to develop a lupus flare in pregnancy. So that
okay,
means that it's a 1 in 3 chance. That's almost like flipping a coin, you know, that's pretty high.
yes,
And 60% of patients, around 60%, once their disease is not controlled or they're having symptoms. So if you have lupus nephritis and your disease is not controlled and you get pregnant, there is a 60% chance of developing complications in pregnancy. And those complications include worsening of your kidney function. It includes implications for the baby itself. So you could have a high risk of losing that precious baby. You could also have a high risk of the baby being born with a lot of medical issues or complications, as well as a low birth weight baby,
right,
right?
right.
So there are a lot of issues when it comes to a lupus patient having a pregnancy. It needs to be a planned event. So just need to make that clear,
I think
right?
that's the most important thing. Definitely, it has to be planned with
Yes,
all physicians on board, because as you said, having lupus and being pregnant, that's a high risk state.
that's right.
So that is a
So,
definitely important point, Doc, that you
so
mentioned.
when you see your rheumatologist is going to put you in a category based on your risk of complications in pregnancy, right? So we know that when you are diagnosed with lupus, there are many different criteria or many different things that you can say or you can test for to confirm that you in fact have lupus, right? So if one of the things that you have is a marker called your antiphospholipid antibodies. Now, there are different antibodies, like we said before. So if you have particular antibodies, it means that your risk of developing blood clots during your pregnancy is even higher, right? And in that case, you may either be advised to start aspirin at a very early stage in the pregnancy, or you may even be advised not to get pregnant at all, right? Now, if you have there's something in pregnancy that they call preeclampsia. That's where your blood pressure goes up and your kidney function may decline, or you may have protein in your urine. If your risk of preeclampsia is quite high, it is usually recommended that you start aspirin earlier, right? The obstetricians would be better able to tell you exactly when. From my recollection, it's usually in the first trimester, so around week 11 or week 11, 12, around there. they usually start you on aspirin based on your risk of developing preeclampsia. And that delays the possible, it doesn't totally eliminate the risk of you getting preeclampsia. It just delays it up to term, which is around week 36 or 37. So the answer to that question, if you should start aspirin in your first trimester, I would say it would be based on your risk. So after you are assessed, this is after having at least 6 months of having a low disease activity, you need to be assessed by a rheumatologist and your obstetrician as well to determine how much at risk you are.
Okay, that was a great explanation. Thanks for taking us back a bit, talking about the risk of pregnancy. However, having lupus is not a contraindication to becoming pregnant or to start a family, but we just want our listeners to know that it takes planning because some of the lupus medications can be toxic to the fetus.
That's right.
So we are going to field another question. Someone is asking, can lupus nephritis be reversed?
Well, in terms of reversing lupus nephritis, unfortunately not. Unfortunately, when it pertains to diseases of the kidney, there is, I'm not going to say never, but there is seldom any reversal, which is why as kidney doctors, we speak about slowing the progression of kidney disease rather than curing kidney disease. So you have to think of kidney disease as a highway. So it's like you're on the highway and you're driving, let's say from Kingston to Montego Bay. Now you could get there in 2.5 hours if you really put your pedal to the metal, you know, but you could also get there in 6 hours. You could get there in 2 days. It all depends on how fast you're going. So if Montego Bay, no insult to the Montegonians that are tuned in, but if Montego Bay is considered end-stage disease for this analogy, our job is to make you reach Montego Bay as slowly as humanly possible, which is why we put you on medications that slow down kidney damage and slow down your progression. So unfortunately, lupus nephritis or kidney disease in general, it is not reversible, but with the right medication and with the right lifestyle changes and modifications, we can in fact slow down your rate of progression and you can live quite a normal life off of renal replacement or dialysis. Oh, Dr. Lowe Jones, you're muted.
Sorry. We do know that lupus is a systemic disease, as you rightly pointed out earlier, and that sometimes patients can have what they call a flare of their disease. And what we're trying to do is really put them into remission and keep them there. Remission meaning keeping the lupus quiet. One of our audience members are asking, are there any natural remedies that can be used for treatment? Now, we didn't speak about the treatment of lupus nephritis as yet. So I don't know if we want to hold on the treatment questions first and maybe take another question about, somebody asks, can early diagnosis of lupus prevent renal failure?
Well, as we said before, the presentation of lupus, it varies from person to person. So there are a number of criteria that must be met. I think there were different ways we would diagnose lupus in the past. So we used to use, well, formerly, about 10 years or so, we used to use a criteria where you have 17 different things. And out of the 17, you just need about 4 or 5 things, which means that you could have any combination of symptoms, any combination of presentations that would diagnose lupus. Now, there are a lot of patients that may be diagnosed with lupus that never go on to develop kidney disease or lupus nephritis. There may also be patients that their only criteria or their only indication that they have lupus is when we check the kidneys and realize that they are in fact positive for certain antibodies and stuff in the kidney, right? So it varies from person to person. So to say early detection is always, as a health rule, early detection is always a good prognostic feature, meaning you will always do better when you start to treat something very early rather than finding out much later on. But having lupus does not mean or does not guarantee that your kidneys are going to be affected.
Okay, great. Thanks for that. Someone is asking about, again, there's two questions on herbal medicinal teas with medication. Is it okay? So maybe we just tackle that question from the get-go.
Sure. Well,
herbal medications and teas, and everything, it's a cultural thing as well, because we live in a society where herbal preparation and herbal teas is quite common. So there's a two-part question now. Can they take herbal medication, herbal medicinal teas, and any advice on taking these herbal preparations with their actual lupus medications?
Okay, so I would begin by saying, as medical physicians, we practice evidence-based medicine. What that means is that the medications that are prescribed are usually as a result of it being tested on a wide population that have a particular condition. And based on the results of the test may show that X drug or Y drug is of significant benefit in this population with this particular illness, right? So why I said that is when it comes to herbal medications and natural medicines, they may not be as well tested as the drugs that we prescribe. That does not mean that natural medicine and herbal supplements are bad. Matter of fact, I take some of them myself just for personal well-being. So nothing is wrong with taking natural supplements, juicing your carrot and your cucumber and all of those things. Nothing is wrong with that.
That's great. That's good to hear.
So when it comes to your overall well-being, I say natural is always better, because a lot of these medications, we prescribe them based on a risk to benefit ratio. So what it means is that the risks of the medication or side effects may exist, and you may get some of them, but the overall benefit of the medication is it outweighs the side effects or the risks. So can you take natural medications or herbal supplements to cure lupus? Now, that has not been studied, because remember, the herbal and the natural stuff, it was not studied in a particular population, right? Now, just based on principle, herbal supplements and natural juices, natural products, they do your body good. So it may be beneficial for your overall well-being, but specifically to the case of lupus, as in you're taking herbal supplements for lupus, that is a bit dangerous, because you don't know whether your herbal supplements are working, because they have not been tested on a population of patients that suffer with a particular illness. Why? Let me give an example. So everybody in the Caribbean know, if you have a little pressure, garlic good for your pressure. So you take some garlic, whether it is you boil it or you chew it or whatever you want to do, but garlic can lower your pressure, right?
That's right.
garlic has never been tested in terms of by how much does it lower your blood pressure? Does garlic work in everybody? What about the use of garlic in men versus women, in people of a certain age versus, a younger population, so to speak? So if I take garlic for my pressure and it works, that doesn't mean that you're going to take garlic for your pressure and it works. You might take garlic for your pressure and your pressure does not move, or it probably increases and you end up in hospital with significantly high blood pressures. Now, a blood pressure medication that has been tested, it has been proven in a is in a wider age group, in a large population setting, proven to lower your blood pressure by X amount, let's say 10. It lowers the top number by 10 and the bottom number by 5 in 80% of patients. Now that is more objective, and it is on that basis we have evidence to prescribe you medication. So when it comes to lupus, we just go with what the evidence shows, and we cannot hang our hats on simply using the herbal supplements or the natural products, even though they may not be bad for you. They are not bad for you. So that's what I would say about that.
Thanks for that explanation. Now, we know a lot of our lupus patients have, arthritic pains, and along the same lines as, I guess, herbal preparations. Can you speak a little bit about nutrition on a whole and the importance of exercise? Maybe sometimes, both of these modalities can assist with pain management in our patients.
Well, when we speak about nutrition, I'm thinking from a kidney perspective. We often use what is called the renal diet, right? Now, the kidney diet, or the diet that is recommended for patients with kidney issues, is usually a diet that restricts sodium or salt. It sometimes restricts potassium based on your potassium levels, and it also restricts certain things like phosphorus and calcium. It's not a one size fit all, but it is designed to achieve the best outcome out of your kidneys. Now, if I use that principle in terms of your diet and exercise when you have a chronic illness, it is always beneficial that you maintain a diet that is generally low in saturated fat and low in sodium, because sodium encourages a lot of fluid and water retention. And it is always better to try and maintain a healthy body mass index. So you should have a healthy weight as it pertains to your height. Now, patients with systemic lupus, because of the amount of inflammation that is going on in the body, it tends to put you at an increased risk of developing heart disease and getting strokes. You are at increased risk simply because the blood vessels, that's where most of the inflammation is occurring. It makes it more likely for little plaques to break off. And if they break off at the heart, you can get a heart attack. If it breaks off in the brain, you can get a stroke. So usually you would find that your rheumatologist may put you on cholesterol pills or statins, things that end with statin, atorvastatin, rosuvastatin, those drugs. And you may say to yourself that, yeah, but why am I on this and my cholesterol is normal? But what this statin does, it not only lowers the cholesterol, but it also stabilizes your blood vessels so that it makes the plaques less likely to fall or to break off. So it actually has a lot of functions, not just limited to lowering your cholesterol. But I digress. So
great.
in terms...
I'm glad that you spoke about strokes, because one of our listeners indicated that she suffered 2 ischemic strokes. So it's that you mentioned diet. And tell us a little bit about exercise.
Okay, so usually any form of cardiovascular or exercise to strengthen the heart is always good. It is recommended by the governing bodies or the World Health Organization that you exercise at least 3 times a week for a total of 150 minutes. You could either split that up into 3 times a week or, every day. And it has to be at least moderate intensity exercise. What that means is, 1, you have to sweat. So taking a cool stroll in the afternoon, that's not exercise, right? Walking from the bathroom of your office to your desk is not exercise. You have to sweat. And your heart rate has to go up by at least 20 to 30% for it to be considered moderate intensity exercise. And that must be sustained over 150 minutes for the week. You can decide how to split it up. And that has been proven to yield positive benefits in terms of your heart health and in terms of your overall well-being.
Great, great. That's great. That's great information to know. Let's divert a little bit more now into some of these medications that our patients take. We know that one of the backbone treatments for lupus are steroids, prednisone. We love to hate them. The patients, they have a love-hate relationship with prednisone. And hydroxychloroquine, we also know, is a backbone medication treatment for lupus. What about the long-term effects of prednisone? Is there anything that they should be concerned about in terms of the kidney? Because we know that we use prednisone to treat the kidney. However, we do know it has many other side effects as well. But any long-term effects with prednisone or hydroxychloroquine?
Well, absolutely. Prednisone, like you said, it's a love-hate relationship. I call it a blessing and a curse, because prednisone is one of the drugs that is found to work really well in lowering inflammation. But of course, this sometimes comes at a significant cost to the patient. And I don't mean financially, because prednisone is definitely associated with, for the women, which is most of the patients with lupus, is associated with weight gain. It's associated with high blood pressure. Some develop diabetes. It can cause your skin color to change. It can cause your face to look very round at times. There are a lot of things that occur with prednisone, but what
about one of the most important ones, Doc? Stretch marks. The ladies. Ladies.
Right. It
don't
definitely.
Like stretch marks, Doc.
Yes.
How could you leave that one out?
Yes, that is true. That is true. Yeah. So stretch marks. That's also an unfavorable side effect. The thing about it is, what we've found is usually this is associated with, like you said, long-term use, and it is dose dependent, meaning the higher doses that you're on for sustained periods of time is the more likely you are to develop these side effects. So this is why our rheumatologists or our nephrologists, even us, we try to lower the dose of prednisone to your lowest tolerable dose. And that way it sort of mitigates the unfavorable side effects. And we try to put you on what are called steroid sparing agents. So there are other drugs that function to keep the immune system quiet, just like the steroids, but they don't have the unfavorable side effects that the steroid may have. So usually it's a transition. Once you have a flare, you're going to go on prednisone, and it's usually a moderately high dose. And we try to get you down as quickly as possible and introduce steroid sparing drugs.
Okay. You mentioned that word flare. Can you talk a little bit about what a kidney flare is, or when the kidneys are starting to act up in lupus? What are some of the signs and symptoms you'd want your listeners with lupus nephritis to know about a flare? What is a flare?
Okay. So again, I'm going to backtrack it a little because I get this question a lot in practice. When it comes to kidney damage, we have acute kidney injury and we have chronic kidney disease, right? Now, the difference between your acute kidney injury is that, just as the name implies, it's acute. It's less than about 3 months' time, right? Now, chronic kidney damage is when you have ongoing damage to the kidneys, which occur for at least 3 months, and you have particular markers that you test for to see if they are persistent over 3 months. Now, if your kidneys get acutely damaged, sometimes that may mean that you have very deranged kidney numbers when you do the blood tests. You're passing a lot of protein in the urine. Sometimes you have a full-blown flare, right? Now, what a flare is when the immune system, it has an exaggerated response to a trigger. So you have a lot of factors that contribute to flares. Some of it are environmental, things in the environment, things, stresses in life, you know, your genetics, a lot of things contribute to an exaggerated response by the immune system. And if that affects your kidneys, sometimes you may have so much damage that you may actually need dialysis, which is kidney replacement. And going on dialysis for a lupus patient does not mean that you have chronic kidney disease or that you are going to stay on dialysis. I just want to make that clear, because in a large percentage of patients with acute injury, once the injury improves and once we treat it, you can actually regain. It never goes back. Remember, kidney function, it never goes back to where it was. But once we slow it down and we treat it, you can come off of dialysis and you can live with being dialysis free. The only difference is you would probably have damage that occurred from that acute episode, and you are highly likely to develop chronic kidney disease, right? So let me just make that clear. When you have chronic kidney disease and you progress through the stages, because there are 5 stages of kidney disease, when you go from stage 1 to 2 to 3 to 4 to 5, and your lupus continues to attack the kidneys, eventually, once you have reached a point where your body can no longer keep up with the functions, it can't eliminate, your kidneys can't eliminate waste, they can't make the hormones necessary for your survival and stuff, that is when you approach end-stage renal disease. That's when you may go on dialysis long-term, right? So
we don't like the word dialysis here. We
yes,
hope these patients will never have to
absolutely. It is
go that
our
route.
goal to never have patients
That's
reach
right.
the point of dialysis. But I know a lot of patients, they think that if they have an acute flare and somebody tells them they need dialysis, they blatantly refuse it because they don't want to be on dialysis. But the thing is, sometimes it may need to save your life. And then subsequent to that, you can be taken off of dialysis when symptoms improve, because in some patients, they actually improve a lot, right? So dialysis is not a death sentence, and it is not a long-term thing in everyone, right?
Right.
But,
So then how often then should patients get their kidneys checked? Because as you rightly said earlier on, some of them have no symptoms. They don't see the frothy urine.
right.
They feel fine. So how often, how often should these patients be followed or their kidneys checked?
If it's a patient with no symptoms at all, or they feel fine, I would recommend that you do a urine test and a blood test twice a year. Every 6 months, you check to make sure, because one of the earliest signs of damage to the kidneys would be protein in your urine. And if you have a small amount of protein in your urine, so much so that you don't have any symptoms or you feel fine, that is something that, if left untreated, can develop into something major. So if you check your urine and you have protein, we can give you medication to reduce the amount of protein and to protect the kidneys from progressing.
Okay, all right. So we are winding down in our time, so maybe just a few more questions. So we have a question here. How do I know if my kidney problems are related to lupus. Now we know, as you rightly said, many lupus patients may have other diseases, hypertension, diabetes. How would they know that, wait a minute, what's going on? My doctor says my kidney, something is wrong with my kidney. Is it related to the lupus? You know, so how would they
Yes,
know?
that's a brilliant question. And how we approach it is, if you have more than one or illness, such as you're diabetic, you're hypertensive, and you have lupus, and we want to know which one is causing which, usually we just examine each one individually and determine, okay, is your diabetes controlled? Is your high blood pressure controlled? If those are controlled and you continue to have protein in your urine, or we continue to see that your creatinine, which is a measure we use in the blood, the creatinine level is above the normal range, then the definitive test we use to determine lupus in the kidney is a kidney biopsy. And based on the kidney biopsy, we would determine exactly what type of treatment you need, because there are 6 classes or 6 patterns we can see on the biopsy that will tell us how the kidney is being damaged. And based on the pattern, we can prescribe medication to address that problem.
Okay, okay. So overall, what is your advice for persons with lupus who've been taking their medications quite fine, compliant, doing everything they're supposed to do, and some persons say, I'm still not feeling well, I don't think I'm getting any better. The numbers seem to be getting worse. Is there any indication that something called a kidney biopsy can be done in any of these patients?
Okay, so if you are on certain sets of medications, and as it pertains to the kidney, you find that your numbers are still going up, meaning your creatinine is going up, the protein in your urine is still up, or you have blood in the urine as well. As long as you have a certain, we would check to see how much grams of protein you are passing in a 24-hour period. So when you do the urine test, based on the number, we can tell you, okay, you definitely need a kidney biopsy. So the cutoff in terms of the number of, in terms of the protein, would be 500 grams in a day. If you are passing albumin in excess of 500 milligrams in a day, then that is an indication you would need a biopsy. If your kidney numbers are increasing and we seem to be on the right track in terms of treating you with certain medication, still not getting the desired effect, then we're definitely gonna need a biopsy. And if your symptoms don't improve, and we are giving you the right treatment, we may have to resort to a biopsy as well.
Okay, this may be our last question, Doc. There's a question from one of our viewers on YouTube. Can you comment on what's the difference between class and stage for lupus and CKD?
Okay, so when we speak of chronic kidney disease, we're speaking of stages, right? So it goes from stage 1 through to 5, and usually what we use calculations based on your age, your gender, and your ethnicity, and your creatinine levels. We use those factors, we plug it into an equation, and we get a number, and that number gives us an idea of how well your kidneys are filtering. So there are certain ranges we expect when your kidneys are filtering at stage 1, stage 2, stage 3, stage 4, stage 5. So as your filtering ability declines, your stage increases. So Somebody that is at stage 1 would have a filtering number of, let's say, 90 and above. As you get down in stages, when you reach stage 5, for example, your filtering ability is between 0 and 15. And when it goes even further down, that's when you get to end stage renal disease. That's where we don't want to be. Now, as it pertains to the classes, the classes speak to the patterns of injury on a biopsy. So if you get a kidney biopsy, you can be anywhere between class 1, 2, 3, 4, 5. Now, you don't need to know the different classes. I think once you are being guided by a doctor, he or she will explain the classes or what class you are and what that means for you, right? We're not going to get overly scientific, but basically the different patterns of injury are divided into classes as it pertains to findings on the kidney biopsy.
On the biopsy. All right. Thanks for clarifying that. Well, we're actually out of time. And I think this was a great stimulating session that we had with you. You gave us lots of pointers, medication, herbal preparations, diet, exercise, prednisone. What did you call it? The
blessing and the curse.
Blessing and the curse. And so, you know, it's good to know that the Lupus Foundation is here to support our patients through any questions that they may have, right? And I just wanted to say thank you for hosting, for coming on this evening and being a speaker and expert. 772-992. If you have any questions, also donate via our website. We're on Facebook, Instagram. Thank you all for joining us today. Have a great night.
Love your kidneys. Have a good evening, everyone.